Complications of the flu. Despite the fact that you will most likely be very upset during the flu, it usually goes away without leaving any long-term effects. Children and the elderly, on the other hand, who are at a higher risk, may experience complications such as infections in the ears, sinus infections that are severe, infections of the bronchial tubes, pneumonia, meningitis. Pneumococci is the most common and dangerous of the complications mentioned, to the point where it can be fatal for the elderly and those with chronic diseases, so vaccination against pneumonia and the influenza virus is recommended. Diagnosis of influenza. The symptoms of influenza are frequently used to diagnose the illness. In some cases, a polymerase chain reaction (PCR) test may be used to confirm the virus type. Treatment for influenza. Medicines to relieve symptoms, such as those to lower body temperature and relieve nasal mucus and cough, are used to treat influenza. 2 new drugs aimed at limiting the spread of the influenza virus in the body have recently been released on the market. These are the 2 drugs. Oseltamivir is a type of antiviral drug. Zanamivir is an antiviral drug. These 2 medications are only helpful if given within the first 2 days of a flu infection or as a prophylaxis after being exposed to the virus. Important information concerning the use of antiviral drugs. Antiviral drugs for influenza A and B operate by inhibiting an enzyme required for the virus to develop and spread. If the pharmacological treatment is started as soon as the first symptoms of influenza show, the duration of the illness can be reduced by 1 to 2 days. These medications may induce adverse effects such as dizziness, nausea, vomiting, lack of appetite, and breathing difficulties, as well as the development of antiviral-resistant infections. The U.S. Food and Medicine Administration, FDA, required the manufacturer of oseltamivir to add a warning to the treatment's label in November 2006, advising patients with influenza, particularly youngsters, of the potential of confusion and injury from taking the drug. The FDA also urges persons who have taken the medicine and have influenza to keep an eye out for signs of odd behavior. Before using any drug in general, or an antiviral medication in particular, it is always advisable to visit a doctor. Vaccination against influenza. Shot can prevent the disease, however influenza cannot be prevented with a single vaccination. Instead, the vaccine must be received annually to keep up with new strains of influenza viruses. It is critical to vaccinate at-risk individuals between the ages of 9 and 10 months before the advent of winter. Vaccination categories that are recommended. Vaccination is suggested for adults over the age of 50 who are in good health, pregnant women who are scheduled to enter the 2nd or 3rd trimester during the influenza season, medical personnel, children and people who are not in the most vulnerable groups, particularly small children aged 6 months to 2 years, should be vaccinated because they are at risk of influenza complications. Influenza vaccines come in a variety of forms. Vaccines are divided into 2 categories. Vaccine containing a dead influenza virus, which is the most widely accepted vaccine today and is administered via an injection. Live attenuated virus vaccine, a vaccine that contains a live but attenuated virus. It is a vaccination that is awaiting final clearance and licensing, and its advantage is that it is administered via nasal spray rather than injection, avoiding the discomfort associated with injection. Vaccine effectiveness. The vaccine's efficacy is very high, ranging between 70% and 100%, and there is a match between vaccine kinds and disease types in the relevant season. In the absence of such a match, or when the immunization is given to the elderly or newborns, the efficacy reduces to around 40–60%, while the efficacy against illness sequelae remains strong even in these instances. The vaccination does not cause flu and has very slight and transient adverse effects, however it is not recommended for persons who are allergic to eggs. Therapies that are not conventional. Although there are no herbs that can treat influenza, various herbs and natural ingredients can assist to alleviate its symptoms, including licorice, guava, 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 pomegranate, garlic,